Everyone, including Joe Rogan, Dana White, Jeff Bezos and their pets are on it. Even scientists like Andrew Huberman have joined. Why? They have slowed down the effects of aging, they feel emotionally better, they feel physically better, they look better and they perform better. So should you be on it too? What am I talking about? Testosterone. Hey, it's Vlad. I'm UK-based health coach and nutritional therapist. A couple of years ago, I was suffering from pretty severe case of anxiety and depression. At the time, I had no idea this was linked to low levels of testosterone. I mean, testosterone is great for big muscles and high sex drive. How could this be linked to mental health? Right? Before we get into this, word of warning. I am knowledgeable and very passionate about this subject, but I am not a doctor. So this video is for education and entertainment purpose only. Saying this, if this video can help just one person towards better health and ease some suffering, I have fulfilled my mission. What is testosterone and why does it matter? Testosterone is the primary male sex hormone. It affects our muscles, bone development, red blood cell count, body fat distribution and obviously our sex drive. Testosterone affects our hair, or for some of us, the lack of it. Healthy levels of testosterone protect our heart and prevent onset of diabetes. Testosterone also modulates how we feel emotionally, or drive to be productive, or cognitive function, mental clarity and decision making. Testosterone also plays a large role in sex function, libido and sex drive. Just remember what it was like when you were 18 or 21. Yes, like that. In a big way, testosterone with other hormones affects who we are not only physically but also mentally and emotionally. Testosterone levels as we age. Healthy testosterone levels, as defined by NHS in the UK, are between 10 and 31 nanomole per liter. Healthy level of free testosterone is about 2 to 3% of that. As we age, after the age of 30, our testosterone levels decline by 1 or 2% per year. For various reasons, for some of us, this decline can happen significantly faster. So by the age of 40, and especially at the later age, we can have dangerously low levels of testosterone. This issue can be compounded by rising levels of SHBG. SHBG is a protein that distributes our testosterone around our bodies to tissues that need it. Only testosterone that is not bounded by SHBG can be active in our body. So not only our testosterone decline as we age and SHBG rises, this leaving us with very little free testosterone in our aging bodies. Obviously, this is not ideal. Do you have a low testosterone level? Ask yourself questions like, do you have a lack of energy? Do you fall asleep in the afternoon or straight after the dinner? Do you have a reduced sex drive? Do you exercise regularly but cannot stay in shape? Do you have brain fog? Do you suddenly struggle with mental health issues? If you have answered yes to any of these, I highly suggest you Google up Adam questionnaire. If you answered yes to most questions within the Adam questionnaire, you're most likely suffering from low level of testosterone. As a next step, I will hardly suggest you have a blood test, whether this is from your National Health Service provider or through private route. Use a blood test done by a trained medical professional, where your blood sample is taken from your vein. These tests are highly accurate. Avoid home finger prick tests, as these are very unreliable. The NHS in the UK specifies that levels below 10 nanomole per liter are low. Also, if your testosterone levels are within the normal range, but towards the lower end, if your SHBG is high, you could have low free testosterone. This is very common for older guys in their 40s and 50s, as was my case. So if necessary, consult medical trained professional, ideally someone who specializes in hormone replacement therapy, and work on the best treatment for you. Closing thoughts. Testosterone may not make you super muscular, make you rich, or get your girlfriend half your age. Well, that one actually possibly... Well, let's not go there. What I wanted to say, to be the best father, best husband, the best man you can be, we need functioning body and mind. As we age, our testosterone levels decline. However, what we do about it is completely our choice. We have accepted that ladies need HRT for healthy function and quality of life during peri and menopause. Hopefully it's time we can accept that men may need medical help too. If you have any question, leave them below. Thank you for your time. See you next time.